Welcome back. This is The Edge of Adventure. My name is Adam Asher. And as always, I have a very special guest on the line today, joining us from some part of the world doing something of significance, serving other people. And today, it's my privilege to introduce you to Veronika Cejpkova. And she's joining us today from Whisper in Uganda. So, Veronika, welcome to the program.
Thank you, Adam. Thank you so much for your invitation. It's a pleasure.
We look forward to getting to know you today and also getting to know your organization, Whisper. And the overview, right? We'll go through, we'll talk, and I'll ask a variety of different questions. But for someone who is being introduced for the first time to Whisper, what do you tell them? Your organization does what?
Well, I love our vision and mission to tell them first. And the mission, that's what I'd love to say, is reviving trust in charity and humanity by becoming the children's hospital with the highest positive impact in Africa. So Whisper, it's a children's hospital and maternity. Also have a school for underprivileged children, small school. And we also do outreach work, medical outreach work. So it's basically a union that does various things that connect to our patients and to vulnerable sick children. Yes.
So when did you start Whisper? And again, for those listening online or listening to the audio version, you can get to know this organization by going to whisperorphans.org, whisperorphans.org, and the name of the organization is Whisper. Veronika, when did Whisper start?
Well, it legally started in November 2010. But of course, we've started to work. I raised money for Whisper in 2009. So that's when for the first time came to Africa. I traveled through 9 countries and I loved every single country. And for some reason, we ended up in Uganda. Actually, the reason to come here was that Uganda had very friendly people and literally yeah, it's just the minute I came here, I just could never go back. I just could never go back in my like in my vision. Like I knew that's where I have to be, where I have to work, where my purpose is. So 2009.
Walk us back through that. You arrived 12 years ago in Africa and you very much fell in love with the people and the country of Uganda. Why is that? Friendly people, what else?
Okay, friendly people. I've loved. I don't know. I feel like I've always could have a lot to talk to them about. I feel like we connect. I feel like we could spend hours and hours in the evenings just to talk about life and how we imagine life should be. And people here deserve opportunities. People here deserve to discover their talents, their great skills that they have, and to utilize them to something greater. And I could see that the opportunity for me to basically show it, like to help them discover their talents and that they could actually find a purpose right here with me. And I don't know, it was just I came back to, because I used to live in England. I came to England in 2004, and so the first time I came to Uganda, I've spent here for about 2 months. When I got back, the first 6 months I dreamt of only Africa, Uganda. Every single night I had those dreams, and I'm thinking, this is a sign, this is where I have to go. And it was just surreal. It was like, so that's how I knew that I needed to be here.
What is the situation for orphans in Uganda?
Wow. There is first of all, I feel like there is the need for the orphans and for children and for people in Uganda. There is a need for quality healthcare. That's definitely like number one thing. And it also involves the kind of value, like recognize their value as human beings. Like that's what I feel like people are not given, are not showed that value by, by the system here. Let me say, like any healthcare services, they don't operate with the same aim as Whisper does, and they don't believe in the same things because they perhaps I can't explain it. All I knew that when I came here, I needed to establish something that's, it will be our own little world where people will find hope, which people in Uganda hardly have. They don't believe in hope. Because they don't have opportunities. They don't have what to really live for. They live for today only, and they don't believe in the next 10 years because they don't have that hope to hold on to. They don't have those opportunities somewhere. They don't have that security that somebody cares for them, like, let me say, the government. And so when I saw how people and women and children suffer here at hospitals, and yes, children come with, in dying conditions, and there is maybe nothing much we can do because there is no special care, there is no, there is no proper equipment, there are no resources, but all we can do is to always give hope to people, to the mother who has to go back after she loses her child. She has to go back to her family. She has more children. She has to continue going, being strong, in this unfair world. And seeing losing your child in a place where people don't care because they also lost that kind of motivation, it's hard to then go back and continue being your best version of yourself as the best mother or best husband or wife or citizen, But that's all I knew, that if Whisper can operate that kind of facility, that even if we cannot help to save the child's life, we always show that we care and we do our best, so that the mother or the person gets hope, and knowing somebody actually is caring. It's amazing. Basically, this is a transformation that Whisper does in people's lives. We can't save everyone. It's impossible. Right now, we are in lockdown. We've lost today 10-year-old child who came here with malaria. His hemoglobin was only on number 1 level. And by the time he got to the hospital because of the lockdown, it was too late. And our team had no blood on the site. We are just getting in this evening. And it's so frustrating. We knew we cannot save that child, but the kind of care and the welcoming environment that we have showed to the mother, she knew that we've tried our best. And now she knows there is humanity somewhere out there. So I think with that kind of thought and idea, I brought Whispers, and I tried to develop Whispers in this country.
Veronika, how large is the medical facility that Whisper operates? And part 2 of that question, how does the government in Uganda feel about this facility? Are they supportive? Are they appreciative? Do they distance themselves? What is the situation? How large is the facility, and also what's the interaction like with the government?
Mm-hmm. The facility on its own is small, but it's a small facility, but it has about 100 employees. 80% of those are professionals, people, the doctors, nurses, the bachelor degree individuals that we employ, which is wonderful and amazing. And literally, as much as it looks small, it does the scale of the National Referral Hospital here in Uganda. So we see about 1,000 outpatients every month. Those are children, and we admit around 230, 200 in patients who are very, very, very sick. As the only private facility, as a non-profit facility hospital, we have fully operational nutritional unit. So that's where the government actually came in about a year ago to help us to incorporate the nutritional unit, and we receive from them nutritional feeds for malnourished children. So that's, I think, the positive side, how we can work with the government. It wasn't for free to get there, and that is the honest truth. The people in power of, to help us supply those nutritional feeds had asked a lot of money for the training. We had to train in nutrition some of our staff members, but for now we are receiving free nutritional feeds for malnourished children, and we are doing just great. We are in fact doing better than the government hospital itself here in this district. According to the statistics that we have around 60 to 90 malnourished children every month here, and the outcomes are incredible. So in regards to this cooperation with the government, yes, it works great. Otherwise, it is always a challenge to work with the government here, always a challenge. It's not so much challenge of the institution, it's the challenge of the individuals that are in charge of, let me say, of the district, small departments. Those people are those that often block opportunities for us, or, let me call it, they are corrupt, and they don't have the best interest or intention towards I don't know, us. That's always a challenge. But otherwise, yes, when it comes to the people up there, yes, they do appreciate it, love what we do. They come here from the main Ministry of Health headquarters, and they love everything about what we do. However, the hands are also short. They also lack resources. But yeah, so we are kind of independent here. And we're trying to help as much as possible. So the government now is looking into where else private facilities like Whisper can help them. Right now, we can diagnose and treat tuberculosis, for example. Before, it was only up to the government, public health hospitals, health centers. So yes, we are trying to work together as much as possible in the best way.
This is The Edge of Adventure. My name is Adam Asher, and my guest today is Veronika Cejpkova. And I hope I'm saying that something close to correct, Veronika. Again, Veronika Cejpkova.
Perfect.
Sound good? Okay.
Really perfect. Lovely.
And she is with Whisper, and you can learn more about this organization at whisperorphans.org. That's whisperorphans.org. Veronika, you mentioned that, and this is not unique to that part of Africa. This happens in many, many parts of the world. Perhaps it's more an indication of human nature, but there is corruption that is often dealt with, and it means that, it stands in the way of progress and it stands in the way of care. But if corruption is wrong, then I know from researching your organization, you all take great efforts. You make great efforts to be transparent and to make sure that everybody can see where the money is going, and that everyone understands that when they give to Whisper Orphans at whisperorphans.org, there is accountability and transparency. Talk to me about that, because I think one of the reasons why a person might be leery or, resistant to giving, they might think, well, I don't know where that money's going to go, right? But you all have taken very clear steps to make sure that there's no doubt about that. Tell us about Whisper Orphans in that regard.
Okay, so first question was about corruption. Yes, there is in a small areas, in those small offices, the public offices in now, let me say, um, parts of the districts, the people who are there, they work mainly with, often with uneducated individuals, and corruption is huge, and it leads to frustration. So people often frustrate you, like they don't work as fast as they're supposed to work. They don't report things they're supposed to report. They are not quick to help you. They have the answers, they have the ability to help, but they will frustrate you, until you basically either give them what they want indirectly, or until you don't let yourself to be frustrated. And that's when, then the good work that we have, like the good work that we do, comes in. And I normally go directly to the supervisors or to people who have the power to correct whatever is wrong in the, whatever wrong is happening. So that's how we're trying to overcome the corruption. People know by now that uh, I don't I don't give money to people for them to do something that's wrong. They have to do it because because we have the how would I say it? We have the impact, we have the data, we have the we have all proper paperwork in order to operate properly, in order to have opportunity to report well to the district. Like there is so much bureaucracy, but then it's always somebody from from different higher area that supports us and comes and help us. So that's where we don't need to go directly to the one that tries to frustrate us, because I feel personally, as me, I don't like to associate with such people. So that, I think, answers my first question, that in regards to corruption and in regards to the accountability, that it's so much close. Like it's I need to have transparency on absolutely everything. So in regards to expenditures and incomes, for example, everything is recorded. We have data available for every single expenditure. We have requisition forms. We have right now we're trying to do everything digitally. So normally we do bank transfers, paying over goods or medication or that, salaries. Uganda is also getting a little bit, they like to also now have control over transparency. Like they want organization like Whisper be as transparent as possible. So they really control how many employees we have, if they're all registered well, if they're all paid salaries that we say we pay, if the taxes are paid that we say we're supposed to pay. There is no anything going on under the table. Like they literally supervise us, and they inspect us quite often. So I have to make sure that as everything is I'm accountable for everything, because the minute there is a little gap, that's again something can come in. Like that's where the opportunity of corruption or something, that is this loophole that they can take and say, aha, so either we're going to give you this penalty, or we're gonna get in trouble, or you have to give us A, B, C, D. And that's always I'm trying to avoid, if you understand me. So in regards to all the donations and everything that we get, we basically we report it with the charity commission. We have to report it here. So we are audited as well.
This is The Edge of Adventure, and my very special guest today is joining us from Uganda. Her name is Veronika Cejpkova. And you can look up their information, get to know them a little bit more online at whisperorphans.org, whisperorphans.org. And when you go there, you will see, Veronika, won't they, that there are different programs, there are different projects, and they can participate and help you fund certain projects, certain objectives. So I know, because this is kind of how you guys think at Whisper, you like to break things down into a very understandable um, project, so that a person knows, if I give this much, this is the kind of help that it is going to provide. So let me ask a question. I'm going to ask it maybe in a little bit of a strange way. What does it cost to save a life?
It is a strange way, but literally, if you look into again our income and expenditure and the statistics that we have available, it costs around $14 to save a life here at Whispers. And it's incredible because, again, like the impact that we have, the kind of people we employ, as I said, we employ amazing professionals, we employ doctors, we employ nurses, we employ admin staff that help us also fundraise and, make sure that accountability is here and everything is transparent. Plus, we are saving all these lives, and so each life takes $14. Only $14 is amazing.
So then let's talk about the level of impact. If you were to describe the impact that Whisper is having and has had.
Wow. So today we, for example, have a free cell clinic. I don't know if you've ever heard of sickle cell disease. I really heard about it the first time, literally when I started to deal with, children born with sickle cell disease. Today we have free sickle cell clinic. It's a preventable clinic for children born with sickle cell disease, where we check their hemoglobin level, see if they are not anemic, and we provide free vitamins, folic acid, so they don't get into sickle cell crisis and they don't suffer from sickle cell complications that are literally very dangerous. Sickle cell complications are one of the worst you don't want to get in Uganda, especially when in this country full of poverty. So in this lockdown, we have children traveling still at this lockdown from different districts. The impact is amazing. We get patients they can travel 100 kilometers to our hospital just for the care. And it's mainly spread by word of mouth, So when Whisper started in 2010, at the time, I was all about helping the malnourished children, the abused, malnourished children, and helping them to get better and go back to their families, But after about 4 years, I realized that, there is much we could do much better if we change the strategy, how we should help people and how we should provide them again the opportunities that they need. And through healthcare and through the idea of healthcare, Whisper's Hospital opened in 2016 in March, and it was amazing. Like the first month, we've had so many patients, and the services that we provided for the little that at the time, for the little funds that it cost, it was unheard of. And today we've treated over 50,000 patients. This is unbelievable. It's amazing. If you think of that, if we started with 30 beneficiaries and, 200 beneficiaries a year, and now it is, annually over 12,000. It is amazing. And the impact is great. We don't treat flu here and cough only. With 60% of our admission are blood transfusion. Every day we revive children from death to life. We have neonatal services. We have ICU literally for newborn babies. We are one of the best with handling of premature babies. So right now we are like known for that kind of amazing service. It's affordable, and in fact we have become a neonatal unit here. We have so many newborn babies from all over the places. We refer them to Whispers, and going the extra mile for the patients. That's the amazing impact. It's another part of the impact that we have. We don't care how long you're going to stay with us. We don't care how much it's going to cost us, as long as we know that there will be amazing outcome out of our treatment. And that's what I have to say. I have seen some of the worst things here. Literally, in January, we admitted a child who was bleeding constantly from her nose, and she was she was anemic. So she received many blood transfusions, but her hemoglobin wasn't going back. Her platelets were very low, and she kept bleeding. And people have absolutely nothing in their pockets. They come here hungry. They spend whatever they had for their transport or for treatment elsewhere, and then what do? We have to help the child, and starting to help to such a complicated patient, it's going to cost lots of money. We have to involve specialists. You have to involve very expensive drugs, and it's a kind of it's a run on a long track. So this child came in January, and she was born with sickle cell disease. She got complication of sickle cell disease. She got autoimmunity disease that cost us about $200 just to correct. And by the time we corrected the disease, the autoimmunity disease, she got sepsis inside her bones, and she's basically started to get pathological fractures. Like all of her body was breaking in pieces. Her bones, anyway, you took her, she just broke. Like the bones were just breaking. And she was only 7 years old. She was in so much agony and pain. She got tuberculosis. She was resistant to so many drugs. We had to do so many x-rays that we had to fund. We had to call so many specialists to go and review her, and those specialists have to be paid. And, it is like no child should be born to suffer this way, So if this baby was brought to any other place, the baby probably wouldn't be alive and wouldn't be treated the way she's treated now. And it's amazing to see from like after 6 months having her here, being now getting life back, after the struggle. And she's not the only patient that we have here. We have amazing stories. So that's the extrema, that's the impact. It impacts not only the patient, it impacts everybody else around her, and especially also our employees.
Veronika Cejpkova is my guest today from Whisper, and she's joining us right now from Uganda in Africa. So, Veronika, thanks again for being on the show. Got a few more questions here. Going to maybe shift into some questions about your story. I want to know why you. What is your background? What prepared you? I generally find that in life, the things we go through, sometimes we don't understand them, but they tend to be preparation. Oftentimes, they're preparation for something. Why you? Why did you, or how did you get to this point where you are giving of yourself and your time and your talents in this way there in Uganda?
I don't know how I can answer this, Adam, because I even wondered myself. One day, I was about 23 years old. I was an air hostess. So I was in London and I worked as an air hostess, and I loved it because I could care for people there, and I was never scared. I was kind of devoted to be there for the passengers in all sorts of situations, and I never thought of myself that I can ever get in danger. I always believed I'll be fine. And I've always wanted, at the time I realized that I need to live a life where my life will make as many people happy as possible. So I imagine when I'm on a deathbed one day and I'll see this queue of people behind me that I've managed to make smile. But I didn't know how I could make it happen. And I don't know, it's just happened that I believe in science, and I always look into the science. I always lived in a different world, I guess. Always thinking of my own thing and looking at little, around me, what can give me direction to go where I'm supposed to be. And that's how I got to Africa. And I don't know. I even had to go to a tarot lady to ask her the same question, like, how am I ever going to survive? I like charity. I need to be doing this. I need to be in Africa, but how do I ever going to live there when, I believe that all the money that I ever raise have to go to help the people, because I've always felt like I'm fine. I'm going to be fine. And the tarot lady had actually gave me some answers, which are kind of, that's for another, maybe another show. So I don't know. I'm just following my heart.
So we got the answer. Veronika got to this point in her life because she followed her heart. All right, we'll accept that answer, Veronika. I think that is probably quite fair. Veronika Cejpkova is my guest today here on the Edge of Adventure, joining us from Uganda. And Whisper, they are a children's hospital in Uganda, and they are in the business of caring for people, and they do so in a very, very important and noteworthy way, which is why we wanted to be sure and have Veronika on the program today. Okay, let me ask this question then, Veronika. What does it mean to do the right thing?
Wow, this is something that I'm trying to teach our people here all the time. Not everything is always pink and beautiful. Sometimes when there is so much of competition, especially between charities, and people always want the funding, they want to be the ones that they get the funding, and they tend to pursue whatever they do is beautiful and pure. That's why you have to donate to us, because we manage the funding the best way. We get the best people, we're doing the best thing. But I have realized over the time that having an impact and being basically doing the right thing and doing the good thing, there is lots of evil out there. And there is lots of fear as well, and fear sometimes makes you not to do the right thing. And that, I believe, when at the end of the day you can get in trouble. And doing the right thing is always acknowledge and accept that, yes, maybe I didn't make it quite right now, maybe I have made a mistake, this is what happened, look, this is what happened, but I'm gonna take full responsibility for it, so you can trust me. I always say to people here, like, doing charity or doing something good in Africa, where there is so much, number one, corruption, so much theft, people with wrong intentions, people who don't live for today, so they don't think of tomorrow. And there is lots of the bad side of humans, because they're just trying to fight for survival. But if anything goes wrong and people try to attack the charity organization and attack me, or to try to pull us down or get money out of us, I'll always acknowledge it, accept it, say it to the people who invest into us. I'll tell them, this is what happened, this is the kind of situation we are going through, but you know what, I'm gonna fix it. I'm not going to give up and run away. This is what I signed up for. And if you have to have trust in us or in me and the way I handle the situation and handle the finances and handle the charity, I have to also overcome the difficulties that many people give up. People come here, they start up something, and they can't cope with the disappointments, heartbreaks, with the frustration, corruption, and they just leave. After some time, especially when they become threatened on their lives, and when children, their life, like, people here threaten a lot. When they want to frustrate you, when they want you to give up. I believe that countries like Uganda, people are led by fear. They install fear in you, so you do what you want. You do exactly what they want you to do, and that's when you end up doing the wrong thing and not the right thing. So I always say to people, stop fearing and let's do the right thing. because we'll be protected at the end of the day. We get through it. And I think that's how much it means. There is lots of fear doing the right thing. You fear for your life, you fear for the life of your children, you fear for your job and for anything. But to me, it always worked out.
Veronika, the world often tells us in one way or another that we should take care of ourselves first. We should take care of our needs first. Do you agree with this advice?
Yes, absolutely yes. Though I think it depends what we think of taking our needs first. I chose to celebrate every single day. There is, as I mentioned now in my 2 minutes ago, there is a lot of bad in this, let me say, in this world of goodness. There is so much bad that is trying to interrupt you from what you're doing. Be really strong. How you keep yourself strong is to care for yourself. And that people don't realize quite soon enough. Like, people always expect you to look at it when you do a charity, but if you look like a charity, you will not be able to, to me, be strong enough. So choosing to wake up every day and put on the best shoes that I have, and and chose to celebrate the day that's going to give me strength. And also other people will look at me and they see, aha, we're gonna be okay. Veronika is fine, we are going to be okay. And that's something I realized. When lots of trouble comes around you, and they looked at you as the primary person, they need to also keep going as employees, as people we are helping. They also want to look at you knowing that they have a support in you, that you are not breaking apart. If you're breaking apart, if you're sick, they also feel like they cannot continue. So caring for yourself, loving yourself first is very important. Like, I need my coffee every day, for example.
Hey, look, I think that's fair. I think that coffee is totally fair. And I understand exactly what you're saying. And yet, of course, I know that you have made many decisions in your life to put other people first and the needs of the people around you and the needs of these people in Uganda. So it's a balance, I think. But I wanted to get your take on that. And they came to mind in particular because I've seen some of the things that you've written and how you express yourself. And you are constantly putting other people first. Okay, so that was a great answer. Good, you passed that test. And so let's wrap up the show today as we talk with Veronika Cejpkova from Whisper, and you can look them up at whisperorphans.org. But let's talk today about love. And I know you have talked about love being the answer. You've even explained, or you've sort of made this argument that love is power. Explain that to me.
My God, I don't know how I can explain love is power. Of course, because when you have love, it will allow you to do everything that I need people at Whisper to do. Yeah, that's when you start giving hope to people. Love is power. Love. If you have love, you will. First of all, you will always want to get the best out of the person you are working with. So, for example, me, I always look into the people that come around me, like the people I employ. I don't want to see them the way they come to Whispers. I need to see them better people, better version of themselves. I always tell them with Whisper, you have the opportunity to be the best doctor, the best version of a doctor, or the best version of a nurse. And it starts out with, for example, how we beautify ourselves. I love to see beautiful things because there's so many bad things happening around us and so much horrible and painful things we see every day. And it really can drain you down so bad. But I constantly, that's a rule here almost. we want to beautify ourselves so you can feel better about yourself, and you receive beautiful compliments, you receive this nice energy, it all creates love, you receive smiles, and then you pass it on to other people. It creates this extra mile for our patients. You do it with great energy, and you don't mind to hold their hands for 16 hours of your shift. You don't mind to travel with them far for blood transfusion. That's the power. That's I believe that's how Whisper is so popular in our community. That's the kind of impact it has, because people know us for it. People take advantage of it a lot, but that's what we are against. Advantage. I mean, like, people like to get free services out of us. Yeah, they don't necessarily need them. But I always say, even those people with money, they deserve that kind of, I don't want to call it free service, but when you give something for free, you literally, it's a charity, it's love, it's what it is, and some, even people with money, they are always expected to pay, especially here. They are always also taken advantage of, and showing them this love that, you come to us, we'll help you no matter what, with this smile, that will impact your heart so much that you'll go back home believing, the world can be a good place. And that's gonna change the person that we impacted. It does change people, and I see it in our employees. They learn a lot of good things and then they apply it in their families. It's beautiful to see. And so it is not only Whispers helping, just treat malaria and flu. It is really doing it everything with love. It's so important. We got to change. We got to start doing things with love and treat each other with respect, and not to look at, like, I always say, embrace the differences between us, the poor or the rich, the blacks and the whites. I love that. It gives me lots of hopes and energy, and that's what we are here. We don't care about what religion you are in. We are a non-religious organization, and I love to embrace everyone. And it's so beautiful to see how we together without pointing. Oh, you are praying to the wrong god, or you have a wrong culture. We can't. It's beautiful to embrace everything, and because we want to see only the good in one another, that's what we focus on. You get amazing. You do amazing CPR. Wow, you motivate me a lot. Oh, you are such a great mobilizer. So it's also, I love the fact that I'm in control of the kind of people that I can surround myself and others with, and get the best out of them. And that's also other part of Whispers. It's not just money, donations, free things, free handouts. It's a bit more than that. I would describe what love is the answer, I guess.
Veronika Cejpkova is my guest today from Uganda and Whisper Children's Hospital there in Uganda. Look them up at whisperorphans.org. And Veronika, how can we help?
Yes, I'd love at least spreading the word, sharing Whisper stories, our hospital page. It's incredible what we are doing here. And I believe if people out there who maybe want to help, who look for help charities, what's happening here is amazing. And I see it every day. People don't realize what's happening here. Like the daily stories we have. I believe if people really knew, they would always want to support this hospital. So they can help by just visiting Facebook. We are there. We do daily posts. We interact with our followers a lot. They can donate through DonorSee. DonorSee is the website where we broadcast our daily projects, like patients who need X-rays or who need blood transfusion. They can donate a few dollars through that page and get in touch with me. Whoever wants to help, we welcome any kind of exposure or financial help.
Okay, ladies and gentlemen, you know the drill. You know how this works. My encouragement to you is to reach out to Veronika and the team at whisperorphans.org. At least contact them. Let them know that you appreciate what they're doing, because I know you do. And I know that the encouragement means a lot to Veronika and her team. So let her know that you saw the program today and that you have checked out the website, you found out more about their projects, and you just want to encourage them. And of course, as always, if you're able to support in some way, if you feel called to do so, you should absolutely get involved. Veronika Cejpkova is my guest today. She has been the guest. You can look up their information at whisperorphans.org. Get in touch there, find out more, reach out to them, and also, of course, come alongside them in some way there at whisperorphans.org. Veronika, I have enjoyed this conversation a great deal. You're a very interesting, inspiring person. I thank you for the time you've taken today, and I've also very impressed with this journey of yours for the last 12 years there at the Children's Hospital in Uganda. Please know that we see you, we see your sacrifice, and we see your work, and we're thankful, so very thankful for people like you.
Thank you. Thank you, Adam, so much for invitation and for your interest in hearing my little story of what's happening here. It's very important to us.
Encouraging everybody to reach out to whisperorphans.org. That's whisperorphans.org to find out more information. My guest today has been Veronika Cejpkova, and she has joined us from Uganda and the offices there at the Children's Hospital. So again, Veronika, God bless you. Thank you for your time, and we'll be in touch again soon.